So why does my back hurt? Great question, JP. So that's probably the key question that a lot of patients who we see ask us. And, you know, as a clinician, we need to know the spectrum, essentially. So you could have a sore back because you have a malignancy, cancer, an infection, a fracture, or, you know, disc prolapse or nerve compression. That's for 1% of the population. It's very rare, but we mustn't miss it. The majority of back pain, we know, is not reliably attributable to pathology. So that makes it a bit of a black box, and it's often described as non-specific low back pain. All that means is that there is no pathological process you can identify on a scan. Doesn't mean it's not specific. It just means you can't identify it. It doesn't mean you can't touch it, because we see in the majority of patients, you touch their back, it hurts. They're sensitized to movements and postures and to touch. Muscles are tense. But there's a whole lot of factors that can drive that process. And we know this from the research. Some of it might be mechanical load, muscle tension. Some of it's around fear and overprotecting and guarding your back. Some of it may because you've got crap sleep. You know, your sleep's really poor. Maybe that you're not engaging in physical activity. It may be that you're carrying a lot of extra body weight and eating really bad nutrition, and you've got pro-inflammatory factors in your system. So there's lots of reasons why we hurt. We hurt more when we're stressed, when we're tired, when we're run down, when things are tough in our life. And that's about the sensitivity of our nervous system. The job of the clinician is to identify what factors are important for that patient at that moment in time, and then to target those factors in a very specific way to get them back to living again, help them make sense of what's going on and get them back to living.